You're watching Cetome TV. Knowledge is power.
Okay, Inga wants to know, how does knowing your inherited mutations help you prevent cancer?
So I would say that knowing your inherited mutations and having an idea of what what sort of behaviors to avoid, what to avoid in life. So for example, many of us will, as teenagers, will go out, we'll smoke cigarettes, we'll drink, we'll do experiment with different things. Some people experiment with drugs and so on.
Right.
I think if you have a knowledge that certain things are going to have a much higher impact than you, for you,
yeah,
then not, then you're going to think about certain things. You're going to think about taking up smoking.
You
You're going to think about
been around teenagers.
For sure.
Yeah, young adults don't necessarily think ahead.
No.
But I do appreciate the point you're making.
But think of it as a seatbelt.
Mm-hmm.
Most teenagers do put their seatbelts on. Whether they feel like it or not, they do. There's something in the back of their heads that says, it's probably a good idea.
Yes, it's called a mother or a father. We're not going anywhere until you put your seatbelt on. But I understand. Okay, so the answer to the question, or at least a part of the answer, is if you understand that you have certain inherited mutations that could lead to cancer, and you're at an age where you want to actually think ahead and take good care of yourself, you can then use that information to avoid certain stimuli, food, substances, things like that could be worse for you than someone else.
Yes.
Yeah, that is a good point. The other thing is, maybe you're about to mention this, about how then you can kind of keep an eye on early.
Oh, for sure. Yeah. Early monitoring, of course. That's the most obvious benefit of it.
Yeah. So it's not exactly prevention, Inga,
but it's monitoring as well.
Yeah. And I know I've heard you say a number of times to people about how the earlier you can detect cancer,
the easier it is to treat.
So that would fit in here too. If you know you have certain mutations, you could be on the lookout.
Early detection, early surveillance, yes.
Thank you for watching Cetome TV. Subscribe below and stay informed.